Hi, my name is Cindy Walker. I'm one of the nurse practitioners here at Student Health Services. And today we're going to spend just a little time talking about healthy ear care, which is important to us all. So let's talk a little bit about cerumen and earwax. So we know that we need a little bit in our ears because it does serve as a protection. But when there's too much in there, that's when it causes a problem. So why is that important? Or why do we notice that we may have that problem? Well, there are a lot of different diseases that can affect the production of our earwax, so that may lead to problems. Other things, as we get older, there are some changes in our ears and some changes in the earwax production, so that can be a problem. But the biggest problem that we see, it's just kind of those bad habits that we have when we're trying to clean our ears. And so that can really lead to an impaction or buildup in the ear. So when we see you, sometimes you may have a buildup and you may be asymptomatic, meaning there is no symptoms at all. One of the most common that we hear is, ooh, hear, I can't hear. So that's one of the most common. Other times there may be ringing in the ear, ear fullness. Some individuals get kind of dizzy or lightheaded when they have an impaction or buildup. And sometimes there's just kind of itchiness or a cough that you may have, and you may not know that that's a problem. So what do we want to avoid? Well, there are a lot of different objects that we want to avoid putting in our ear. So one of the most common is a bobby pin or hairpin. So seems like a good idea to get in there and get that stuff out, but you want to avoid sticking that in the ear because all these objects can cause further impaction, but they can also cause ear damage or a rupture of the tympanic membrane or the eardrum. This is a pimple extractor. Some people have never seen this before, but believe it or not, some individuals use this sharp object to clean their ear out. Others use their keys, or one of the other most common thing is a Q-tip. So it has the wood end of the plastic and you have like the cotton on the edge, and they'll use that to get in there. I have ear pods here. I'm not telling you to avoid your ear pods. I'm telling you just caution, because a lot of times the more we use them, if there's earwax, we can push it back a little bit further. So just kind of caution with that. And then also sometimes the noise level. We want our music to be loud, but we gotta, keep it down a little bit, okay? Ear candling. I don't know if you've heard of that, but that's where you can take a candle, one portion goes in the ear, the other you light it, and then the wax is supposed to, that warm moisture is supposed to suck that earwax out. Well, that's one of the things you really want to avoid. I know there's some things on the web that say to use that, but I'm going to caution you because of the injury and the burn that can happen when you use that. So the most important thing, everyone, is just remembering good healthy ear care, making sure you don't put sharp objects in your ears. If you're having problems hearing or something's going on, make sure you follow up with us at Student Health Services. Or if you just have some questions, just go to our portal, go to that secure site, and just send us a message, and we'll be more than glad to get back with you. And then we can help you with that. All right? All right, we'll talk to you a little later.